Having a heart attack can cost you about $200,000 plus emergency care. Diabetes medication could cost you, over a lifespan, right? Thousands of dollars, right? Tens of thousands of dollars over your lifespan. Cancer, this is a big one. Cancer, if caught late, can cost you hundreds of thousands of dollars. It can cost that much money if caught late versus the $10,000 it might have cost to prevent the thing. So let me talk about my late father, right? Passed away when I was a first year medical student going to second year, right? So actually during that summer. And I remember probably a few weeks prior to the end of the semester, calling him up, say, hey, Pops, what's going on? I was just in the hospital. Everything's okay. Like, oh, what? Right? Like, I don't know, what are you talking about? Like, I was in the hospital, right? So, of course, right? And fortunately, where I went to medical school, like in South Florida, is in my house, right? Like near my house, right? So I drove down and say, what's going on? Ends up telling me that he was in a hospital. He was having some chest pain, chest discomfort. Actually ended up being diagnosed, right, with an aortic aneurysm, right? And the doctors were like, hey, you got this aneurysm, it's large. And, they did what they had to do, right? Thankfully. And I remember thinking, like, hold on, like, here you have a son in medical school, right? Who, again, I wasn't medically smart at the time, right? But I was at least inclined. And I still, right, had questions that he did not have the answers for, right? And I realized very quickly, like, man, if like this person right here can go through an ordeal where not only does he have this chest pain, chest discomfort, gets diagnosed with having an aneurysm, and after all of that occurred, still not, have all the answers, I can only imagine, right, where it all started, right? So of course now when I'm digging deep, apparently he's had high blood pressure, he has high cholesterol, he has all of the risk factors, but he wasn't taking care of himself. And this is a story that unfortunately isn't uncommon, where you have the issues, right? And, it's diagnosed like, hey, you got hypertension, you got this, you should manage it. And you kind of put it off, right? You put it off and say, hey, I'll get to it when I get to it. I got to work. I got a family to take care of. And I can assure you that this does not have to be you, right? This does not have to be a story, right, that relates to you as well. But for many people, it is, right? Because for many people, the act of preventative care isn't urgent enough for them, right? Like they don't understand that my dad suffering a heart attack, right, and end up getting an aneurysm, right, and end up ultimately passing away, shortly thereafter, just from complications, like didn't have to happen, right? That was a failure of prevention, right? And I think a lot of time when I talk about this, a lot of times when we talk about prevention, people talk about it as if there's no consequence to not being preventative, right? Like they talk about it like, I didn't do my preventative thing, but that's okay. Everything's all good. And that is far from the truth, right? So again, I just want you guys to kind of understand that, like when I scream on here, right? When I get on here on my YouTube show, my podcast, my blogs, when I talk about prevention, I'm speaking from a place of personal experience of what happens when you don't focus on prevention. Right. Like I have a family member who's no longer here with us because he did not focus on prevention. And I was, like I said, I wasn't Dr. Barry back then. Right. Like I was just what did they call us? OMS 1, right. Going to OMS 2. Right. Like I was just a medical student, but not having prevention, especially for my father, right, is the reason why he's not here today. Right. So I want to talk about that because I think it's so important to understand that you got to have some type of game plan when we're talking about the prevention thing, right? We can't just walk the walk. We have to talk the talk. We have to do it. We have to take the action at hand, right? Because if you take the action at hand, you don't end up as a failure, right? I want to think about that. You don't end up as the person who failed at preventing, right? Because you could have possibly prevented, right, having a heart attack. You could have prevented having a stroke. You could have prevented having the cancer. You could have prevented these things, right? And again, and it's not like it doesn't cost, right? Again, these are just some numbers, right? Think about this, right? 80% of chronic disease is preventable, right? This is a numbers game. 80% of chronic diseases are actually preventable. right? I know that sounds crazy, but the problem is that only 8% of us actually practice consistent preventative care. Why is that? Right? Because the system incentivizes treatment and not prevention. The medical system incentivizes money, right? Incentivizes the treatment. They pay doctors, right, to treat more than they pay doctors more to prevent. And if they pay doctors more to treat than to prevent, guess what doctors are going to do more of? They're going to treat, right? Like they're not going to practice prevention if prevention practice doesn't pay as well as treatment practice doesn't pay, right? That's just a numbers game, right? So these are some numbers, right? Having a heart attack can cost you about $200,000 plus emergency care. Diabetes medication could cost you, over a lifespan, right? Thousands of dollars, right? Tens of thousands of dollars over your lifespan. Cancer, this is a big one. Cancer, if caught late, can cost you hundreds of thousands of dollars, right? Like, and of course, it may not necessarily cost you directly because we're thinking about insurance and all this stuff, but it can cost that much money if caught late versus the $10,000 it might have cost to prevent the thing, right? So you go from heart attack, emergency stay, ICU stay, seeing all the specialists, being out of work, hundreds of thousands of dollars in the hole, or you do a checkup, right? That's $200 a month every year, right? Like that number makes sense to me, right? That number, you do some blood work, that's $100, give or take a year, right? Right. You get your medications that may cost you $20 to $40 a month, right? Like there are things that we can do, right? There are things that we can do, right, that are less costly, right? If our goal isn't to be a failure when it comes to prevention, right? Because failing at prevention will have consequences. Again, you can either see the doctor now or you can see the doctor later, but you will see the doctor, right? 6 out of 10 of those are going to have some chronic illness. Remember, 80% of these things were preventable. Most people don't know they have a problem until it's a crisis, right? Because they're not going to see a doctor anyways. Lifestyle changes prevents about 50% of heart disease, diabetes, and stroke. Just lifestyle changes. For all the people who are pushing, oh my God, the doctor just wants to push meds on me because they get paid. We don't. Yes, 50% of lifestyle changes. Lifestyle changes can prevent 50% of heart disease, diabetes, and stroke, right? But again, it's not taught. Why is it not taught, right? Because the system, right? The system benefits and incentivizes you to be treated than it does you to be prevented, right? You heard it here, right? You heard it here first, right? And if you want to keep hearing things like this first, you know what you got to do. You got to hit the subscribe button. You got to hit the notification bell, right? You got to check. You got to let us know. And on that comment section, hit first, right? Say, hey, first, wherever you at, right? Like it is what it is. Shout out to you. Again, we talked about this, right? Again, just got to kind of go into like the story, right? Like again, my father suffers a heart attack, right? He ends up in the hospital. He ends up, needing heart calves, diagnosed with heart and aneurysm, an aortic aneurysm, ends up having complications later because guess what? The things that he should have did prior to, he wasn't doing, right? He wasn't doing his regular checkup. He wasn't taking his regular medication. He wasn't following up on his blood work. So he wasn't doing none of the preventative things that he should have been doing. And unfortunately, he is here, right? But in doing so, guess what happens? Now he has a son who keeps telling y'all should be about your preventative medicine, right? He has a son who keeps getting online and getting on social saying you should be about preventative care, right? Because if you're about preventative care, guess what happens? You could be around longer, right? Like, because again, I live it and experience every day, right? So I think it's important to understand that when you have a mission, which is like, hey, I want to be here as long as I want. I want to be here. I want to be healthy around for my loved ones, for my family, for my kids, whoever I want to be, for myself, right? Let's be greedy. I want to be here for myself, right? You got to do the things that set you up appropriately. Because again, you're going to see the doctor now or you're going to see the doctor later, right? You got, like, it is what it is, right? So let's come up with a little framework that I have that I call the preventative health game plan, right? Like, let's come up with this framework that I think if we do this, right, guess what? We'll not only be smarter, right? We'll not only will be smarter with our preventative game, we'll get to the point where we decrease our stress of having to be treated for some things, right? So number one, right? Understand what your baseline is. You cannot improve what you don't measure, right? You can't improve your blood pressure if you don't know what your blood pressure normally is. You can't improve your cholesterol, your A1C, you can't improve these things, your weight. You can't improve these things unless you know where you're coming from. Right. So you gotta have a baseline. That's when your annual checkups come into play. That's when you are getting your data, you're documenting your numbers, you understand what's the game plan, because you got to have a reference point. So number one, you got to have your data, you got to have your baseline, you got to have your reference point to understand. Like, so number one is your baseline. Number two, this is what I call the movement system, right? Movement is medicine, right? And you got to treat it like such. Movement is medicine, and you must treat it like such, right? So again, this is when we talk about exercise, right? What is exercise, right? Again, 150 minutes of moderate, intense workout per week, right? Again, 3 to 5 times. I'm not saying every single day, not saying twice a day, right? But 150 minutes of moderate intensity per week, right? However you get it, 30 minutes for 5 days, 50 minutes for 3, whatever, however you get it, you need to get it done, right? Strength training 2 times a week, right? Flexibility, and make sure you got your rest days. I'm telling you, make sure you got your rest days. Don't go out here trying to work out 7 days a week. Get the rest days in, build it in. Understand that, again, 150 minutes equals 40% reduction in heart disease, y'all. 150 minutes of exercise a week equals a 40% reduction in heart disease. It prevents diabetes progression, maintains bone density, and the mental, right? You get to mental together, right? So again, you can go to the gym if you need to. You can walk around your house. You can cycle. You can swim. Some yard work, right? You can do some things there to get it done, right? Now, how do we start? Start early, right? Don't start with the 30 minutes right off the bat. Do like 10 minutes. Do like 15 minutes. Get up to 30, right? Because consistency always beats intensity. Get up to 30 minutes, but don't start at 30 minutes, because then, you know what? If you're not used, some of y'all not used to working out like that, I don't want y'all like to try to get your 150 minutes in one day. Let's be real. Let's be honest, y'all. Let's be honest. Right. So again, and you have to schedule it. Got to schedule it, right? Like it is what it is, right? Number 3 pillar, right? Your nutrition system, right? Obviously, right? You're getting your nutrition together, right? A framework for eating to help prevent the diseases that may be on the way, right? We talk about diabetes, hypertension, high cholesterol all the time, and how much diet plays a significant factor. We talk about how much lifestyle modifications are able to reduce heart disease, strokes, and heart attacks. We talk about that. The lifestyle modifications start with what you're eating, y'all. I tell my diabetic patients all the time, I don't care how great your diabetic medication is, I can't beat your mouth. If you overeat what your medications are trying to stop, it's not going to work. All the time, a patient who's diabetic will come to the hospital and their blood sugars are amazing. You know why? Because guess what? When I put diabetic diet in that computer, that's all you eat. When I put diabetic diet in that computer, that's all you eat. There is no, I'm gonna eat this. Like, no, that's all you're eating, right? So all of a sudden, when you actually hit the numbers that you're supposed to hit, you'd be surprised how well your blood sugars are controlled, right? Sometimes they're too controlled. Sometimes I have to back away from your home regimen, right? Because it's too much, right? Because your doctor on the outside is adjusted for your mouth, right? Like it is, right? So understand nutrition is important. Again, vegetables, lean protein, complex carbs, right? We got plenty of blog posts for that, right? And it's important, right? You don't want to be restrictive. You don't want to be restrictive in what you're eating, right? Because again, I don't get it. And again, it's all about like starting small and then working your way up, right? Starting small, working your way up, right? I like this, right? Someone wrote 80-20 rule. Healthy eating 80% of the time, eat what you want for 20%. I like it. I like that ratio. A lot of y'all are 90-10, 95-5, the other way around. So 80-20, that's the way to do it, right? Again, perfection kills consistency. Y'all trying to be 100% and 0, like eat your pizza, eat that chocolate cake, right? Like stop playing games here, right? But just make sure you're doing what you need to do. Number 4, your tracking system, right? This is another factor that I love, right? Having an appropriate tracking system, like what gets measured gets managed. I love this, right? What gets measured gets managed, right? So if you check your blood pressure, if you check your weight, right? If you check your energy, how much you're sleeping, if you check your blood work, guess what? You can manage it, right? Again, we talk about that baseline, but you got to actually track it as well, right? No point to get it done without tracking it, right? Phone app, spreadsheets, notebook, write it down. However you want to, use technology to track it, figure it out a way, right? Like it is what it is, right? Choose one this week. However you want to do it, choose one way to do it this week. And then last part of the system, right? Your screening timeline, right? Prevention scheduled by age, right? And we got a prior episode earlier this month where we talk about knowing and recognizing, hey, based off my age, what screening test should I have, right? We'll put a link to that episode in the show notes, right? Like I don't need to go any further. I got a whole episode for that, right? Because again, this is what we do. We think ahead. Again, I think it's important. I think it's important when we think about this aspect of recognizing that when you do all of these things, right? All of this, that system, right? And what I'll do, put it in the comments, right? If you say, hey Doc, can you give us a PDF handout for that? If enough people put in the comments, I'll make a handout for it as well too, right? That way you can have the 5 pillars: movement, nutrition, baseline tracking, screenings, lifestyle. If you do all these things there, right, that prevention system becomes amazing, right? If you want to have a game plan, an appropriate game plan, you got to do all 5. You got to do all 5. Like, and again, let's break out the myths, right? Y'all know I like crossing out these myths because I know y'all are on social media, right? So there's someone's going to tell you a lie on social media that I got to knock out right out the bat. Prevention requires expensive supplements, DNA testing. No, even though I know people are selling it, whoop-de-doo, right? Like, in fact, I think if you go to my Amazon store, I have a supplement section, right? I'm not selling it. I do get like an affiliate commission, but like, because I know a lot of y'all need supplements, right? So, but it doesn't require it, right? If you eat well enough, you don't require a supplement. I need to be perfect. No, remember 80-20, especially my diet folks, 80-20, right? Eat your cake, eat your pie, right? Get that piece of pizza. Prevention is only for healthy people. False. Everyone needs it, y'all. It's too late for me. False. It's never too late, y'all. It is never too late. Again, I got patients who are walking around in their 40s and 50s. They're bedbound because they didn't take care of themselves. And I got patients who are 60, 70, 80, free as can be, right? Because they knew that, hey, you know what? I'm not going to allow a timing like, oh, I'm too old to take care of myself. No, they just took care of themselves, right? So it is what it is, right? Like, again, I want to make sure, right? I want to make sure that we go from understanding that, yes, you may think prevention is this complicated process, but again, you enact that system, all of a sudden you can become empowered to do what you need to do, right? It may sound complicated, it may sound hard, it may sound difficult, it may feel like it's too much for me. It is not, right? Like it's all baby steps, one at a time. And again, I'm not telling you to take the 5-step system and do all at once, right? Just focus on one, master one, focus on the other, master that one. Again, like we have to do what we need to do here, right? Again, because again, I always say all the time, right? Again, this is why I'm so big on talking about prevention, right? Because I say, like, if there was a Dr. Pierre, right, when I was, I guess, in undergrad, right, because that's during the time where my father would have been taking care of himself, right? If there was a Dr. Pierre out here like me, right, educating their community, say, hey, you gotta take your blood pressure, right? You got to know what your numbers are, right? You got to keep your weight down. If there's a Dr. Pierre like me, my dad will likely still be here, right? He's not here, right? Because he didn't have the focus of prevention. He's not here, right? Because he didn't have people educating him on, hey, these medications you need to take, you got to take them, right? Like it just is what it is. This is the reality that is hand, thankfully, right? Thank God, right? I'm here, right? Because I'm going to educate my community and everyone who's at the, the reach of the share, right? Make sure, especially when you subscribe, make sure you share these episodes out. Who's in my social media reach to get their stuff together, right? Because that is what it is, right? So again, just put it in the comments. Do the checklist, right, on my YouTube, right? Like put it in the comments, do the checklist, or if you're on my blog page as well too, because we do post it on my website. Just drop a comment, say, hey, can I get the checklist? Can I get the systems checklist, right? And I'll take care of that for you, man. So again, I'm yours truly, Dr. Pierre, the host of Medicine Mondays. That is your preventative health game plan. I hope you're ready. I am ready with you. I'm going to see you guys next week.